Imagine this for a second. You're still young, or be middle-aged, but your erections aren't as strong as they used to be. Sometimes urine leaks after you think you're done in the bathroom. You might feel embarrassed, confused, or even scared, wondering, is something seriously wrong with me? The first exercise is the correct pelvic floor activation. Most men think they're doing it right, but they're not. To find the correct muscles, imagine trying to gently stop urine midstream and at the same time prevent passing gas, without tightening your abs, thighs, or buttocks. The feeling should be a subtle lift inside the pelvis, not a hard squeeze. At first, your muscle may shake or feel weak. That's normal. Start with 10 slow repetitions. The key here is control, not force. Think of lifting an elevator one floor up, not slamming it to the top. This exercise improves nerve signaling, blood trapping during erections, and bladder control. Many men notice better awareness of their erections within just 1 to 2 weeks, but strength alone isn't enough. Erections require endurance. That's where the second exercise comes in, and this is where many men start seeing real changes. The second exercise focuses on endurance and rhythm, which are critical for maintaining erections and preventing urine dribble after you finish peeing. Even if your pelvic muscles are somewhat strong, they may fatigue too quickly. You can do it sitting, standing, or lying down, but beginners usually find it easiest while lying on their back with knees slightly bent. First, take a slow breath in and fully relax your pelvic floor. On the exhale, gently lift the pelvic muscle and hold it for just 1 second, then relax for 1 second. Now repeat this in a smooth, steady rhythm. Lift, relax, lift, relax. Think of it like a calm heartbeat, not a fast twitch. Start with 20 repetitions. As your control improves, work up to 50 pulses in one session. Over time, these pulses train the muscles to respond quickly and repeatedly, exactly what is required during an erection to keep blood trapped, and after urination to fully close the urinary channel. Research shows that endurance-based pelvic training significantly improves erection quality and reduces post-urination dribble. Men often report firmer erections, better control during sex, and a noticeable reduction in leakage within 4 to 6 weeks. One important detail many men miss is breathing. If you hold your breath, you increase pressure in the abdomen, which actually pushes down on the pelvic floor and weakens the contraction. Always breathe naturally. Exhale on the lift, inhale on the relaxation. Now let's add something even more powerful. Most men focus only on contraction, but healthy pelvic function also requires relaxation. A muscle that stays tense all the time becomes weak and unresponsive. This can reduce erection quality and even worsen urinary symptoms. This brings us to the third and final exercise, and this one connects your pelvic muscles to your hips and core, which play a huge role in sexual function and bladder control. The third exercise is the deep squat pelvic release and activation. This exercise improves blood flow, nerve function, and muscle coordination in the entire pelvic region. Stand with your feet slightly wider than shoulder width. Slowly lower yourself into a deep squat, keeping your heels on the ground if possible. If your heels lift, place something under them for support. Once in the squat, rest your elbows on the inside of your knees and gently press your knees outward. Now take slow, deep breaths. As you inhale, allow your pelvic floor to fully relax and drop. As you exhale, gently lift the pelvic floor, just like in the first exercise, but only to about 50% effort. Hold for 2 seconds, then relax again as you inhale. Stay in this position for about 1 minute. This exercise teaches your muscles how to contract and relax efficiently, which is essential for strong erections and proper urine control. It also improves circulation to the pelvic region, supporting overall sexual health. Men who add this exercise often report stronger morning erections, better stamina, and less tension in the pelvic area. It's especially helpful for men who sit for long hours, as sitting tightens the hips and weakens pelvic muscles over time. Now here's how to put everything together into a simple daily routine. Spend about 5 minutes on the first exercise, 5 minutes on the second, and 1 to 2 minutes on the third. That's it. You don't need expensive equipment or supplements. Consistency matters far more than intensity. But there's one more crucial piece that determines whether these exercises actually work or not, and most men completely ignore it. That missing piece is how you use these muscles throughout the day. Exercises alone won't help if your daily habits constantly weaken the pelvic floor. One of the biggest mistakes men make is straining during urination or bowel movements. Straining pushes downward and overstretches the pelvic muscles, making erections weaker over time. Instead, relax, take your time, and never force urine out. Another habit that silently damages pelvic strength is prolonged sitting. Sitting for long hours reduces blood flow to the pelvic area and keeps the muscles in a shortened, inactive position. If you sit most of the day, stand up every 30 to 40 minutes, walk for a minute, or do a few gentle pelvic lifts while standing. Posture also matters more than most people realize. A slouched posture compresses nerves and blood vessels that supply the pelvis. Standing tall, with ribs stacked over hips, allows better blood flow and nerve signaling, which directly affects erection quality and bladder control. Hydration and bladder habits play a role as well. Constantly holding urine for long periods weakens normal bladder signaling, while going just in case too often can confuse the system. Aim for natural, regular bathroom breaks and fully relax the pelvic muscles while urinating. Now let's talk about expectations. These exercises are not a magic switch, but they are powerful. Most men notice improved control and awareness within 2 weeks. Firmer erections and reduced urine leakage often appear between 4 to 8 weeks. Long-term consistency leads to lasting improvement because you're retraining the muscles and nerves, not masking the problem. It's also important to understand when to seek medical advice. If you have sudden erectile dysfunction, pain, numbness, blood in urine, or a history of prostate surgery or neurological conditions, talk to a healthcare professional. These exercises are supportive, not a replacement for medical care when it's needed. But for many men, especially those with mild to moderate erectile dysfunction and post-urination dribble, pelvic floor training can be life-changing. Better erections don't just improve sex, they restore confidence, reduce anxiety, and improve overall quality of life. The key is patience and consistency. Treat these exercises like brushing your teeth. Small daily effort leads to big long-term results. If there's one thing to remember, it's this: erectile dysfunction and urine leakage are just part of getting older, and they're not something you have to silently accept. In many cases, they're signals from your body asking for attention, not medication. When you strengthen and retrain the muscles that support your bladder and erections, you're addressing the problem at its foundation. These 3 exercises may look simple, but they work because they restore something many men lose without realizing it: control. Control over blood flow, muscle coordination, and confidence. When those systems work together again, erections become stronger, urine control improves, and anxiety begins to fade. What matters most is consistency. 5 to 10 minutes a day may not feel like much, but over weeks and months, it can lead to real, noticeable changes. Many men wish they had started sooner. The best time to begin is now, before the problem worsens. Remember, your body is designed to heal and adapt when given the right signals. By practicing these exercises, improving posture, moving more, and respecting your body's natural rhythms, you're giving yourself the best chance at long-term improvement. You don't need to be perfect, you just need to be consistent. Start today, stay patient, and let your body do what it's capable of doing. If you found this helpful, take a moment to reflect on what you learned, and more importantly, put it into practice. Your future confidence starts with what you do next.